Okay, so for our next session, in lieu of Dr. Ryan Halvorson, we have Dr. Drew Lansdowne, one of our faculty members, who's going to be discussing language analysis predicts needs for surgery prior to clinical exam or imaging, and analysis of nearly 3,000 pre-visit patient questionnaires at a sports medicine clinic.
All right, thank you, Dr. Laroque, and thank you all for being here and for having us as part of the program. So Ryan Halvorson is one of our residents, and he's at a family event. He's sad to miss it, but I'll be presenting in his honor. So our disclosures are updated. None are relevant to this presentation. So to start, the impetus for this project is that with specialized physicians in a large group, I think matching patients with physician-specific expertise can be challenging. We often rely on a call center, patients to self-identify, and there may be mismatch between the physician's expertise and what the patient is exactly looking for. I think an ideal triage system would be one where you can match the patient with the physician or the provider who is most likely to be able to provide care that is needed in the appropriate time frame. I think it's also interesting to look back, and something that we've all probably heard is that a careful history will lead to the diagnosis 80% of the time. This is supported by data from the 70s, but we're all told in training that you have to listen to the patient, that they will tell you most of the time what the diagnosis is. Like if we hear they have a pop, they're playing sports, like it's probably an ACL tear, like I can't move my shoulder, it's probably a frozen shoulder. But this information just directly from the patient can tell us the problem that we're gonna treat. So in our sports medicine clinic, we will often have the patient fill out a pre-visit questionnaire. We've moved to getting this online prior to their visit before they've met us at all. For this proposal, we sought to use an AI language model to decide if surgery was likely, more info was needed, or surgery was unlikely. And the thought being that maybe we can use this information to better match the patient with the skill set that they need. So the purpose is to use large language models to predict the need for surgery for new sports medicine clinic patients using only their pre-visit questionnaire data. So this is not incorporating any available imaging, any available extra information, just the words of the patient themselves. The hypothesis is that patients requiring surgery can be identified with reasonable accuracy from these questionnaires. So to perform this, we looked retrospectively across the available data that we have from May 2020 to May 2023. And then we categorize patients as having surgery within 30 days, 90 days, 1 year, or at any time. And then all of the model features are just derived from this patient inputted questionnaire. This is our questionnaire that we use, and this is unstructured. This is meant to be information that we find useful before we meet the patient. So what side are we seeing for? What part of your body is injured? Was there an injury? And then free text for the patient to fill in. Our model evaluation, so we used natural language processing, large language models, and used 5 different models just with various features of processing ability to try to see, is one of these able to predict the best. We used typical training testing methods, taking an 80% for the training set and then 20% for testing, and then evaluated with the area under the ROC curve, along with post hoc text analysis to see if key terms really predicted what would happen. So in our population, about half of the patients had surgery at any time. A small percentage, about 10% had surgery within 30 days, and then increasing across the board. The model performance, so these are those 5 different large language models, and then our best performance was with a random forest model. And this had 92% accuracy in predicting surgical need within 30 days with an area under the curve of 0.67. The other models also performed well, but kind of outperformed by that random forest model. What we found in our post hoc text analysis, we had increased odds of surgery if the patient specified their pain duration in days rather than larger units, so kind of reflecting an acute injury. If they had tried at least one prior treatment modality prior to their visit, if they described NSAIDs, injections, PT, narcotics, or prior surgery. And then if their pre-visit questionnaire mentioned a pop or a tear, that was associated with a higher chance of having surgical treatment. So through this study, we've shown that in nearly 3,000 new patients visiting a sports medicine clinic, an AI-based large language model was able to identify patients requiring operative intervention with reasonable accuracy using only the data that they provide us prior to their clinic visit. I think this suggests that this language analysis of patient free text data could be employed in combination with machine learning models to triage new patients presenting to clinic. So if we know that I have available OR time next week, and this patient has an acute injury that needs surgery, they should be matched with me. If a partner has the OR time, or if they need an ultrasound-guided injection, other procedures, we can better demand match with the need that the patient has. So some limitations, these PAQ surveys were not optimized for this analysis. This is just using the data we have that's available. The model accuracy may improve as we ask more targeted or specific questions. And so in conclusion, I think prioritizing the evaluation of patients at high risk for intervention could decrease the time to surgery for those who need it, while freeing up other resources and personnel for patients in need of conservative treatment modalities. Thank you.